Okay, so I'd love to start with you, Lauren. What was missing in the mental health care space that inspired you to start Black Girls Smile, and what does the organization do?
Try this, okay. Hi, everyone. I was diagnosed with clinical depression at the age of 15 and struggled through the remainder of my adolescence into college, struggled with 2 suicide attempts. And after my second suicide attempt, as crazy as it sounds, I decided that I wanted to live. And I knew to do that I was really going to have to work hard to lead a mentally healthy life. I met with a psychologist on a daily basis for a while, met with a psychiatrist. I was in group therapy, and I got mentally healthy. And graduated, got a great job on Wall Street. And as I looked back over my mental health journey, I noticed that there were really gaps along the way that would have alleviated many of my symptoms and the pressure that was on me, but also my network, including my family and friends. And I put those into 3 categories, which was education, support, and resources. And I felt like in general, those 3 things were really lacking, but especially within minority communities. So at Black Girls Smile, we work to fill that void by increasing mental health literacy, destigmatizing the conversation surrounding mental health, and really focusing on the early intervention piece that is really kind of lacking in the behavioral health field currently.
And so, Kimberly, what is that missing piece for mental health care that Seneca aims to fill?
Can you hear me? Good morning. At Seneca, everything we do is rooted in our values, and our agency's values and mission. Our values are love and compassion, hope and courage, joy, curiosity, and respect. So in every way that we engage with our children and families, how we engage with our community partners, how we engage even with each other is rooted in those values. So when we work with our various populations, be it in a school program, be it in the community, we want to engage with them based on those values. And we see lots of gaps in how education, mental health or mental health awareness is often lacking. So part of our role is to bridge that gap and to bring awareness, help teachers understand. You might have a student who has behavioral problems in the classroom, but there's something that's underlying that. There's something that's often driving what we're seeing in their behavior. So part of what we want to do is help teachers understand that, help school staff and administrators understand what those things may be, help parents even understand what those underlying issues may be, and provide some education and understanding about that. Most of the families that we work with, by the time they get to us, it's a particularly vulnerable time in their lives, and we want to honor and respect that, know that we are not there to solve all of their problems, but for the time that they are connected with us, how can we be supportive of them and supportive to them? How can we connect them to resources? How can we broaden their network of support to help them reach whatever the next level or stage is for them?
And Khaliya, can you talk a bit about the way that you came to recognize mental health as an area of focus and the work that you're doing there now?
Hello. First of all, I just want to say thank you, all of you, for actually addressing the issue of mental health. I feel like I've been banging on that drum for a long time, and it's been a difficult process to get it to the level where people are talking about it, where there's corporate sponsorship. So I'm just so honored that this speech is even taking place, that this panel is happening on this kind of a stage, because it's been a long time coming, and it's a big step for mental health. In terms of my journey to be an advocate for mental health, my background is that my mother was a psychologist and my father's a computer scientist. So I kind of came from both the science background, where you just want the solution, and then the soft background, where you want to know the story and the whys and the hows. If your mom's a psychologist, after a while you're like, I just want the solution. I don't want to talk about it. Please don't ask me. So I tended towards the scientists for a long time, and my background was computer science for a while, but then slowly but surely I got pulled back in the mental health direction, because at the end of the day, as humans, our operating system is based on what is going in there and what is coming out of there, and how we code ourselves is really how we will be as units in society, functioning or non-functioning, and healthy or non-healthy. So I was a Peace Corps volunteer in Bulgaria in from 1999 to 2001. And during that time, I saw two emerging issues. One was the rise of infectious diseases that were antibiotic resistant, of which I became very ill, and I had a life-threatening illness, which made me kind of go into the public health spectrum to begin with. But the other one was a mental health issue, which is that in not just Bulgaria, which is a post-Soviet society, but other post-Soviet societies, you saw death rates, mortality rates among the male populations that were similar to that of Burkina Faso, and places where there was no sanitation, where there was inadequate food. This was a developed country with access to everything. But yet people were dying at the age of 57 was the average for males, which is an incredible statistic and shows how much mental health is really pivotal for physical health. And for me, it was also that mental health is pivotal for the health and development of countries. There's no point being involved in foreign policy if we can't have a population that can get to work every day, that can take care of their families, that can take care of themselves, and that can avoid antagonistic behaviors like violence because they're that upset about the despair and the lack of hope that they have. So for me, that's where the journey began. And since then, looking at it from the sort of science perspective, I looked at it as an equation. Well, what's going in? We're having increasing numbers of people with mental health issues, and what's coming out? Well, actually, more people with mental health issues. They did a study on PTSD for people with Vietnam vets coming out of the war. And for those, 2 out of 10 coming out of Vietnam had PTSD. 20 years later, when they did a check, it was 4 times that. 4 out of 5, 8 out of 10 suffered from PTSD 20 years later. So even the ones that survived were worse, not better. And the ones that had made it and didn't think that they thought they were okay were actually worse, not better. And I think, now that we have statistics as alarming as you said, 1 in 5 women are raped, we have people coming back from the war in increasing numbers, we have to figure out a way to change the equation. How do we get it so the numbers coming in and the numbers coming out are better? The only way that we can do that is scale. And in my opinion, the only way that we can do scale is to change the way that we look at treatment. So I'm on the board of a neuroscience startup, which is looking at new treatments from more of the biological, more of the technological angle. And then I'm also looking into new treatments on the biological level. So new drugs that have the capacity to wound, in some ways, the effects of PTSD on a faster rate, so that we don't need as many service providers to do so.
This is so inspiring to see just how important this issue is on a personal, a community, and a global scale. There's so much to talk about here. So let's go into just some nitty-gritty about the topic. What do you think that communities can do to support members that are struggling with mental health problems, and what should we not do or assume? I'd love to kind of hear feedback from each of you on that.
So I think specifically within communities as a whole, we need to normalize the conversation surrounding mental health. When you think of mental health, you automatically think of mental illness. Whereas we don't all have a mental illness, but we do all have mental health. And starting to normalize that conversation to show people that mental health is a part of your overall health, just like you go to the doctor each year to make sure that you are physically healthy, same should be said for mental health. We within society as a whole are very reactionary. We see a psychologist when things are bad, whereas you can see a psychologist when everything is good. There's always things that can be talked about, dealt with, so that you're leading a mentally healthy life. We also, the word stigma was thrown out many times, specifically within minority communities in the US. Stigma is a very big issue, whether it's mistrust of the medical community, lack of mental health professionals that look like us. But normalizing the conversation, increasing awareness, research, educational opportunities increases the ability for us as a society to see mental health as something, again, everyone has. There are dysfunctions of it, which are mental illness, but kind of opening that conversation up, making sure that people are aware of warning signs, symptoms, but even on a bigger scale, how you lead a mentally healthy life. Mental health is not all negative. There are things that we can do personally, as a community, as a society, to make sure that we are healthy on a large scale, but also on a smaller scale as well.
Hello? Sure. What I would add to that is, when we think about mental illness, is with our friends, our families, our coworkers, that doesn't make them the whole person. When we talk about mental illness, it's often that becomes who they are, and that's all that they are. And going along with leading a mentally healthy life, like, there are other aspects of their identity, of what they're bringing to the table, of who they are. So when you come across somebody in your life, your coworkers, your colleagues, remember that that's not their whole story. We each have a story. There's something there about us, about who we are, where we are, how we got to where we are in this very moment in our general life space. Every community has a story. And I would encourage you all to go out there and find out what those stories are. Find out what the stories of people are, the individual, the communities, organizations. Everybody has a story that impacts how mentally healthy we are, how we look at mental illness and the stigma that's attached to it. I absolutely agree, making it a part of normal conversation, because it is. It is what it is, and we have to remember we all have an aspect of our lives that is about being just mentally healthy, how we function, how we interact, how we engage with people in doing that.
Yeah, it's not. Oh, it's back. Okay. Khaliya, did you want to weigh in on that too?
I guess the one thing I would say is just that I think that there's two conversations that we have about mental health. One of them is the daily mental health of everyone. You know, are you mentally fit? Are you keeping yourself happy? Are you surrounding yourself by the support networks that make that happen? And then the other one is the clinical mental health issues. People with autism, people with schizophrenia, people with ADHD, people that have problems that are not as easy to deal with on a day-to-day maintenance kind of level. And my answers to those are kind of twofold, which is, I think, for the maintenance level, we are all responsible for each other. You know, support networks is the leading indicator of mental health. If you have 6 friends that will support you no matter what, the likelihood of your being mentally healthy is so high. I did a lot on addiction networks and social support networks for people that were homeless, people that had problems with substance abuse, and really the real indicator, the thing that separated you from the person that ended up sleeping on the street or the person that ended up, being a substance abuser, was who was there for you when it went wrong, who was there for you when things went bad. And it can't just be one person, and it can't be 2. You need at least 5 or 6. So that's the sort of social support side of it. On the other side of it, on the clinical side, I think that we do a lot to say that, you know, mental illness is a bad thing. And if you look at people in our society that have contributed amazing amounts to civilization as a whole, the greatest artists of our lifetime, some of the greatest writers, some of the greatest scientists. I mean, even now, if I named the best engineers I know, half of them have Asperger's. But they are the ones that are changing the world that we live on a daily basis. So for me, I see mental illness not always as a stigma kind of thing. I think it's something extraordinary that sometimes we should celebrate. And if you're different, that's fantastic, because we need different people to progress as a civilization. So there's two things. Take care of yourself if you feel like, you just want to worry about the day-to-day. And if you're different, don't think of it as a stigmatized condition. Think of it as something that you're doing that will help all of us.
That's great. I'd also love, just kind of inspired by the commitment that we heard about in Nepal and some of the work that you've been doing, to talk a little bit more about the importance of mental health support in times of disaster and conflict. What is that missing piece? I mean, we talked about it a little bit before the panel. Just would love to have you expand.
Well, there's some pretty shocking statistics going on in the world. When you look at how hard it is, even in your day-to-day, you have a bad day, you get home, you don't feel that great. Imagine if your house fell down and you saw your brother crushed by a building. And they offer you food, and they offer you housing, but every part of your existence has changed. How do you move on from that? How do you then wake up and say, okay, I want to go get a job, and let me go play football? You really, you are in a state of emotional shock that is indescribable. And unfortunately, when you look at the statistics of places post-conflict, for the majority of the situations, you have 1, maybe 5 psychiatrists. For Haiti, it was, I think, 4 psychiatrists for the entire country post-disaster. In places like Nepal, after the earthquake, similar. As you said, it was 0.05, something ridiculous. And I'm not advocating clinical drugs for most psychiatric conditions, and but I do think that the support is necessary, and also honoring the fact that the mind is just as fragile as the body, and we need to take care of it. And in situations like this, the assumption is, if it's bleeding, it's broken. But if it's not bleeding, there's invisible wounds inside when it's your mind. And I think some of the biggest things that we have in post-conflict situations, post-war situations, is you have an immense number of people that have really traumatic PTSD, and you can't rebuild until you address that issue. During war zones, you have so many women that are raped violently. You want them to go back and get a job. What do they do about the children that they had through the people that raped them? I mean, these are issues that take such a depth of emotional experience that I think that the tools that we're giving them now to deal with it are just not strong enough. That's why I'm on this neurotech fund. That's why I'm really looking into both biological and technological ways to scale mental health, because these places will not achieve the progress that they need to achieve until we address the invisible wounds that are there.
Sure. I'd also like to expand upon that. A lot of times I find that people don't even understand what PTSD is. They think of it on this very grand scale. They think of vets. But PTSD can be something as small as domestic violence, even if it didn't happen to you, but you're a child within a home where your mother or your father went through domestic violence, violence in a community, gang activity in a community. These are things that can contribute to PTSD as well. And because of this misunderstanding of what PTSD is and how it can actually affect someone, and that it isn't just, specifically in the US, we think of vets, but it's on a grander scale, and it can affect more people than we know. Specifically in Chicago, with a lot of the violence that is going on now, they're starting to do studies in regards to how is this mentally affecting youth, how this is affecting communities, and they're finding alarming rates of PTSD. And in all honesty, these people don't even know that they have PTSD because they don't think of it as that. So we have to expand our knowledge of understanding a lot of the mental illnesses and some of the more known mental illnesses, and taking away, again, the stigma of what we think these are, what we think these look like, and finding out more information so that if you or someone you know may be experiencing mental health difficulties pertaining to a specific mental illness or something in general, that they're more open to seeking assistance because they may not know something's even going on.
That's so interesting, the kind of disconnect between an issue and knowing that you have the issue, or even thinking to seek assistance. I wonder, is that something that you talk about at Seneca in terms of kind of helping people understand that these are things to talk about.
Absolutely, and I think sometimes it's about the language that we use with people. And when she was talking, it reminded me of when we were starting a school program in Deep East Oakland. If you know anything about Deep East Oakland, violent communities, underserved schools, not a lot of community resources. And we're bringing parents in, and I'm saying, I'm welcoming their child to their school, so glad that you're here. Your child will have a counselor, or I think I said therapist, someone who they can connect with. And immediately, on multiple occasions, well, really took after the first time, a parent said to me, whoa, my child doesn't need a therapist. I'm like, okay. He's like, my child's not crazy. What do you mean a therapist? And I realized I had to change my language to connect with where she was and what she believed she needed for her child. And I said, you know, every student that comes here will have somebody that they can talk about whatever's going on for them, good, bad, or whatever. And she was able to connect with that a lot more. So sometimes I think what we have to do is be mindful of the language that we're using, talk about what people are experiencing, and not throwing out diagnosis and mental illness names here and there that they can't connect to. So the more that we can talk about behaviors, what's going on for people, what their experiences are, and then help give name to those experiences, I often find that that's helpful. So language is important. It means something when we use various words to describe people, and there's a lot of misconception about what people think things are, such as trauma and PTSD or Asperger's or autism. So we have to be really careful and mindful about the language that we use and how we use language to connect with people.
So interesting. And I'd love to go back also to something Lauren said about normalizing. I wonder if we can talk a little bit about how social media is affecting this issue in terms of giving people a platform to share their experiences and connect with each other.
I can start there. So we work out of both New York, Atlanta, and we have some pilot programs in the DC area. And with some of our programs that we've recently done within the school system, cyberbullying has become very big. So I think social media, as it pertains to advocacy in general and specifically mental health, it has this positive side, but it also has this negative side. The positive side, some of the things I've seen, such as Facebook, they've implemented a button that if you find that a post that you see out there indicates that someone is potentially going to hurt themselves or someone else, you can actually report it, and this will alert local authorities, and they will actually dispatch crisis intervention for the person who has put that post up. So really commended Facebook, and there's a few other social media platforms that have implemented things such as that. There's also now the crisis text line. I think we spoke about this previously on the call. The crisis text line started as a kind of passion project through the DoSomething.org, and this woman just decided, hey, why don't we see if people would actually use text for crisis? And she kind of thought she would maybe get 100,000, thousands within the first day. So she kind of spun that off, and now the crisis text line is one of the biggest crisis intervention hotlines that are utilized today, because if any of you guys are anything like my younger siblings, they will text me, but they will not call me. Even if I call them, they will still text me. But you also see the other spectrum, kind of going back to the cyberbullying aspect, where people forget that there's a person on the other side. And in all honesty, just to get real with you guys, people get bold. They get real bold, and they say things that you would not normally say to someone if they were in front of you. An incident that happened recently, not sure if anyone else is up on pop culture too, but there is a basketball player who his girlfriend, his model girlfriend, was caught cheating with someone else, and people started bullying her on social media via Instagram, via Twitter, and it all culminated into her attempting to take her own life based on the things that people who didn't even know her middle name were saying to her. So with social media, I think that youth in general need to have a better understanding of the impact of social media and the fact that it is there forever. And that there is someone on the other side of it. And think about something as simple as would you say this to someone's face? If you don't have anything nice to say, don't say it at all. So you have the positive aspects of it that are increasing awareness. There's a lot more social media accounts. I know that we follow them that are increasing advocacy and opening up the dialogue surrounding mental health and mental illness and normalizing the conversation. But we're also adding this new factor to it all of increased pressure, increased bullying that happens via social media as well. So you kind of have to evaluate the spectrum of it.
Hello? I would add to that, you know, social media is a tool like any other tool. And, you know, what can you do with a hammer? Think about it. You can build things, but you can also destroy things. Any tool comes with it immense power, and it's up to you to decide how to use it. If you want to use it in the wrong way, you can. But if you want to use it in the right way, you can. And that's, I think, you know, that's the joy and wonder and really inspiring thing about technology is we can use it to bring each other up, and we should. And it disappoints me greatly when people use it to bring each other down, which often they do. I have worked with a partner, Cheyenne Ehrlich, to develop an app called Tell Your Story, which is for victims of rape or assault. And people can go on and they can tell their story with either a filter on their voice, a filter on their face. It was live, and then we just took it down to add on a component where you can connect to support services after it. But what I found is, in general, the reason that social media has gotten so huge is because people want to tell their story. They do. It's something vital. It's something that is just so human about us to want to share and to want to tell these yarns about our lives, about what we did. Okay, I don't necessarily want to know what you had for breakfast, so if you want to share that story, please don't send it to me. But most of the time, the stories that people have to share are great. And what I've learned from being in the mental health field is that when you say, you know, I'm here and I want to listen and I want to be authentic and I want to hear your story, and I work in mental health, you hear these stories you would never hear. I mean, people just open up to you in ways that they would never otherwise. And so Tell Your Story was kind of a platform to enable people to tell whatever it is that they wanted to tell, that they maybe weren't, you know, they didn't want to put it on Facebook. They didn't want to tell their friends because they weren't sure if their friends were ready to hear it. They didn't want to be a burden to their friends, but they wanted to get it out. They had it in there and they wanted to get it out. And it's shown to be a very effective tool for people that are grappling with something that's hard for their brain to look at. When you were discussing the ways in which a lot of people with mental health issues, they just don't see it or they don't want to see it. I'm actually working on a book called Blind Spots that's all about how you use these corrective lenses in your head to look at things. You have these biases that are inbuilt in your brain, but you also have biases that are acquired. And these are biases that happen, for example, if you're in a traumatic event, you no longer see things the same way, but you don't know that you have. It's like having something smudged on the lens of your camera, and suddenly you're just missing a corner and you don't know it. I guess my point there is just to say be careful, because what we're seeing now is a bit of a change in what we're seeing in social media. We're seeing a very skewed reality. We're writing about a very skewed reality. And especially when it comes to mental health, you feel that this is not something you want to share because you want to share the good times, not the bad times. But you need to share both. And so I'd say there's an importance of really participating in both in life.
That's great. Kimberly, I'd love to get some advice from you for the students who are interested in starting inclusive organizations and highlighting diversity and addressing social problems on their own communities and campuses.
Yeah, what I would say to those of you who are interested in doing that, really I think echoes some of what we've already said. Each and every one of us in this room has a story. Each and every one of us has various identities, realities that make up who we are and our lives. And when you are starting an organization, I think it's important to remember that. Oftentimes when we talk about, or the word diversity is mentioned, oftentimes our brains immediately go to race. And not that race isn't important to have a part of the conversation, it absolutely is, but it's not the only thing that makes each of us up. And so when you are creating an organization and you want it to be inclusive, remember that your employees, your colleagues, your coworkers, there are multiple identities that they have. There are multiple dimensions of diversity that they're bringing to the work, and you want to tap into all of what they have to offer. Based on who they are, what you can see, and the things that you can't see, and bringing all of that into the organization. And it makes it a much richer environment, lots of perspectives. You want diversity of thought, diversity of problem solving, not just how people look. And that can really enrich and impact the work in ways that are unseen, I think, at times, and that we unintentionally take for granted.
Great. And then maybe some advice from you, Lauren, just about taking a passion and an area of personal interest and kind of turning it into an entrepreneurship opportunity.
So for me, when I first founded Black Girl Smile, I was like, oh, this is awesome. I'm a social entrepreneur. But then I realized very quickly through research and talking to other social entrepreneurs that running or starting a nonprofit or a program or an initiative does not make you a social entrepreneur. Social entrepreneurship is a mindset and a thought process that you want to consistently find creative ways to impact your community as it relates to social issues. And again, sorry, I will repeat this again. Me starting a nonprofit does not make me a social entrepreneur, but my thought process is even if I decide to leave my organization, I still want to positively impact my community. Kind of hearing some of the things that you talked about. They're all, there's so many various things, and that's the social entrepreneur mindset that you have to have, that you want to consistently affect your community in a positive way and finding very creative ways. And when I say that, that doesn't necessarily mean you need to reinvent the wheel, but you need to piece things together and to get out there, learn from the people that you would like to serve, because a lot of times we think we know what they need without actually asking them or finding out from them what they need and how they need it. So going out into your communities, if you have a specific target audience, target age range that you want to focus on, go out there, find out more information about what are some of the issues that are impacting them. You may be interested to find out they want the program delivered in a different way than you necessarily assumed in the first place. So positively affecting your community on a consistent basis and kind of having that mindset. One of the books that helped me the most to learn more about social entrepreneurship was about the Ashoka Fellowship and learning about a lot of the people that have affected people on the grandest scale that I can't even imagine that I would do someday. But those people were constantly thinking of ways.
I see people taking notes. Can you repeat the name of the?
Yeah, so it's called the Ashoka Fellowship. I cannot spell to save my life, but I believe it's A-S-H. Yeah, there you go.
A-H-O-K-A.
And it was a great book that really taught me kind of widened my perspective in regards to what social entrepreneurship is and how you go about kind of getting this mindset and fostering this mindset that you want to constantly affect your community in a positive way.
That's great. Let's open it up to questions. Who would like to start? Don't be nervous. There's somebody in the back. I think we... Just if you hold on, there's a mic coming your way.
Hi. Kimberly. And work. Okay, yeah. So what I was wondering is, how do you guys approach situations that are self-induced, like addiction? How do you propose to help people help themselves, I guess?
If I could answer that question, I did. I actually delivered a paper many years ago to the American Public Health Association that was all about basically the connection between support networks and addiction research. And as I kind of mentioned briefly, there's a lot of research to support the fact that addiction has to do with not biology, not a disease mechanism, but really a disease of society, that you don't have the support that you need. So I think for me, the connection that you can get with people is the biggest antidote to addiction that you can have. You have to, if there's anybody struggling with addiction issues, it's really who you surround yourself with and how you take care of yourself. And that's when this, mental hygiene issue that you both discussed becomes so important, because often when people go down the line of addiction, the things that are in common is that they're out of their element, they don't have any support networks, they don't have any habits, they don't know how to feel connected to something that makes them feel better, so they look to something that makes them feel less. We need to look for things that make us feel better in a more permanent way. And so that would be my answer to that.
I was just going to say, to your point, too, I think everyone has a story. So kind of understanding that you may see this person very much in the moment and their difficulties in that moment, but they have a story. They have not necessarily a reason, but they have something that's behind that. And to kind of break that down and to understand a little bit more of where they're coming from and what they need to get over that addiction is really important in those situations.
Wow, lots of hands. I think I saw the one at the front go up first. There's a mic coming.
Hi, thank you. Hello? Okay. My name is Hannah Gertis, and I'm a senior at Georgetown University. And hello? Okay. I'm conducting qualitative research about mental health during pregnancy. And I know that we talked a lot about the stories and hearing from people themselves before you make recommendations, but I want to ask a little more about that. How do you move from hearing people's stories to making recommendations without jumping to conclusions?
I think part of what is important for us to do in connecting with people is understanding what our values are, and I spoke a little bit before about values. It's having a sense of what our values are and what their values are. And when you can connect and understanding where the shared values are, it becomes easier to have conversations about what next steps can be. I think we often do ourselves and those who are working with a disservice when we think we know what they need or what they want, and we start planning 10 steps ahead based on that without taking time to learn from them what it is that they want. And some of that gets down to what are our shared values? What are the things that we can connect with each other on that we have in common? And when you start there, you can then build on that and get to the concrete things that will be helpful in supporting them moving from point A to point B and beyond. Did you?
No, I was just
Leaning in, that's great. Next question, here at the front. Oh, there, just 1 second.
Hi, my name is Kyra Altman. I'm piloting comprehensive health ed schools in the United States, so it would incorporate health topics. So I guess my question is for Lauren. I know you said you've also piloted this program in schools. What have you seen as the biggest challenge in implementing this curriculum or this program? What do you think schools look for the most? What really gets them to embrace this new strategy?
It can be difficult. You have to get people to understand or to appeal to administrators and teachers and faculty and parents to understand the importance of mental health. I think also to your response earlier, it's also the language that you use. When I first started out, it was very mental health, mental illness, and I've kind of moved more into the realm of saying mental wellness, and I find that people are a lot more comfortable with that language, or saying mental health literacy. So when I say I'm going to teach you about mental health or mental illness, people aren't too open to that. But when I say I'm going to help you increase your mental health literacy, I'm going to teach you how to lead a mentally healthy life, I'm going to show you some warning signs and symptoms, kind of bringing the language down so that it's more digestible, I find is really big with working in the school systems. And I think to the other points that you guys have brought up is having stuff that's interactive. With students, it's very difficult for them to pay attention on something that they think doesn't have anything to do with them, or is very uncomfortable for them. So bringing that language, bringing common language into play, but also making it interactive. So whether it's activities saying, you know, you have a journaling activity this week, write down all of your feelings about things. That's a lot better than saying, hey, we're gonna teach you all of the different emotions that are out there. But kind of normalizing it, giving them activities that really kind of draw them in and emphasize the material that you're trying to get them to digest, I found has been most beneficial.
That's great. And there are so many more questions. I know we are out of time for questions, so we're going to transition into our table discussions. But we're going to walk around, so please grab somebody and bring them into your discussion. Ask the questions one-on-one. This is not over yet. So as we transition into our table discussions, just a couple things to keep in mind, and maybe you guys have some ideas for discussion topics too. One is just, I'd love for you to discuss a little bit more about how you've seen mental health stigma affect your campus community. And then, you know, maybe going back to social media that we were talking about a bit, like how is social media playing a role in this, either in your life or on campus? And of course, thinking of some solutions and some ideas. Is there anything else you guys would suggest?
The only other thing that I would suggest is thinking about ways that we as a society and your communities can move into more of a proactive method and model as it pertains to mental health. Right now it's very reactive, so we're focusing on things once someone has an issue or once someone's showing symptoms, but how within your community, within your schools, you guys can move into more of a proactive model.
Great. Okay, so we have about 15 minutes to chat, and then we'll come back together at the end and get some reports back. So take it away.
Ladies and gentlemen, there is 5 minutes left. Please start preparing your report. Ladies and gentlemen, 2 minutes left. Please finalize your reports. Ladies and gentlemen, please welcome back Anna Maltby and the panel.
I shouldn't have gone so far, sorry. So we have just a few minutes, but I'd love to know more about the discussions that you guys just had. Would we be able to get a volunteer from one or two tables to share kind of what you've been talking about over here?
Hello, I'm Jonathan Young. I serve on the board of mental health at Georgia Tech. And so one of the things we were talking about is how important social media is, how we can use it to our advantage to reach unreached people. A lot of times, it's a two-step process. One is sometimes the stigma makes it hard for other people to realize themselves, how mentally healthy they are or whether they suffer from mental illness. And then the second step is also telling other people. And so social media, what's beautiful about it is it reaches people, it reaches everyone. And so using that to give people the resources and education to help themselves, because knowledge is power. So a lot of times people need to enact like self-counseling also. Like self-counseling is a way for someone to study, the science and biology behind mental health. And so one way to do that is social media, to give resources and education to help people overcome the stigma.
That's so
Thank
great.
you.
Cool. Very nice. Here at the front. Right behind you.
Hi. At our table, we basically focused on the challenges, and we realized that the problem itself is found in the definition of the term mental health. We found out that when we're going around, some people are using the term mental health, mental illness, a disease, and personally I get offended if you say I have a disease, mental health. And so I realized if the complexity is in defining the term mental health, treating or dealing with the issue itself becomes hard. And also the other thing we talked about is overgeneralization. Everybody's different, and we always find ourselves generalizing, like the African culture, this is how they deal with mental health, the white people. But every individual is different in their particular ways, and we are supposed to deal with individuals differently. So when we generalize, we are going to end up offending people, and we're not going to deal with the issue. And also the other thing is cultural sensitivity, which also goes with generalization. The term cultural sensitivity is also as hard as mental health. Cultural sensitivity, which is difficult. So I feel like if terms themselves are difficult to define, the issue is going to be difficult to deal with. I don't know if I've left out something, but can help. So I think that is what we're basically talking about, and yeah.
That's so great. Thank you so much. Great. In the way back.
Hi, everyone. My name is Alyssa Henry, and I'm a junior at Nazareth College. Our table had wonderful discussions, all from cultural awareness to communication. And another important point that I think the room really would benefit from is a separation between learning disabilities such as autism and mental illness and mental wellness. I think that there is a very blurred rhetoric a lot of the times between the two, and they're both very separate and important issues. Thank you.
That's crucial. Yeah, thank you so much. That's great. Right here at the front. Sorry to make you run a lap.
Hi, my name is Marie Louise. So on our table, we talked about how we're gonna provide the resources, let the people know the resources available to seek for help. And we resulted that technology in itself is the greatest tool to use. Social media, the text helpline, and how are we going to bring all of these platforms that are out there online together to to make it a one place, a one source for people to seek for help. There's so many out there, and we believe that it should all come together, and that we should educate the people of the resources that is available. Everybody needs to know, even if you're not going through a situation mentally, it's always good information to know, because especially in college campuses, there one of us even expressed that a friend went through with a roommate who was going through suicidal thoughts, and they didn't know how to help them, and it became a burden on the roommate, because she didn't know how to help them. And that's when I go back to just availing the resources, that's letting the people know that there is help out there and where to get the help. Just keep on educating them. So that's all.
That's so great. Thank you so much. And I have to wrap things up now, but I just want to thank you all so much for being here. It means so much to me to be here and hear these wonderful conversations and very inspiring morning. So thanks a lot and enjoy the rest of the weekend.
Ladies and gentlemen, the working session is now concluded. Enjoy your lunch, and office hours rounds will begin at 12:15. The next CGIU plenary session will begin at 2 p.m. at Haas Pavilion. Thank you.
The people all dressed in black, and all the cars, they look the same. But I got nowhere left to run. I know there's something for you out there in this life. I know there's something for you out there in this life. I know there's something waiting for us in the light. I know there's something waiting for us in the light. I know there's something for you out there in this life. I know there's something for you out there in this life. I know there's something for you out there in this life. I know there's something for you out there in this life.
I don't wanna be the last man standing. I don't wanna be the lonely one, picking petals when the party's over. No, it's not